It's too minimal.
Fallon, hey, long time no see. Oh, you're on mute.
I am well. How are you?
Wonderful. Thank you for inviting us.
Of course.
It's great to see you again.
You all have valuable input.
Hey, Keith, we have a no beard policy here on the campus. So,
Hi, Dr. Barrett.
So I was going to say we have a beard policy. Maybe not for the women, but maybe. I'm not sure. No.
Yeah, well, I was just hiding the double chin for a little while. I've aged a few years since I've seen you. But I've been hitting the gym, so I could probably go back to the bare-faced. Good to see you again. How are you doing, Dr. Barrett?
likewise, it's been great. A little different teaching remote. You don't have that intimacy of the class, and actually our hospital operations class that I usually teach in the spring's been canceled. We can't visit hospitals, so what's the point? So yeah, it's a weird world we live in.
I know that class is a highlight for a lot of students, just being able to see things in action. So that's unfortunate. I really do feel bad for all the students, you know, in this semester and the last, and maybe next year, just kind of missing out on those opportunities.
Yeah, we're exercising new muscles, that's for sure.
Definitely.
So, well, it's so good to see you all. It's been a long time. Sounds like your careers have progressed very well.
And in no small part to our experience at UTD.
Exactly.
So now you get to receive all the questions you used to ask me in my office, and with sage experience can go, oh, don't worry, you'll just be fine, and you'll remember back those days when you were so nervous and anxious, and yeah, it's a good turn of events, actually.
I know. Now we're in the hot seat.
The tables have
But
turned.
hey, you help prepare us, so we're doing the same for others.
I hear you. Paying it forward.
Yes, always.
Hey, well, I'll just jump in real quick. We've got the chat box, so please just stick your questions in. I know also our esteemed alumni have maybe a set of questions. I know Mehul is going to lead the discussion here, but please just reach out, either, you know, raise your hand or put a question in the chat, and then we'll make sure we get that addressed today. So thank you all so much for taking the time out and joining us for this panel. Mehul, take it away.
Definitely. Thank you, Quincy. So before we get started on today's panel, can everyone hear me?
Yes.
Okay, cool. I just want to thank everyone for joining so far, and I hope you guys are enjoying the Career Week. We do have many events lined up and throughout the week for the future. We have Dr. Barrett speaking to us on Thursday. We have Dr. Don Taylor coming to speak with us on Wednesday. So we do have a full packed week of different coffee chats and mock interviews. So I definitely recommend you guys take advantage of these chats and mock interviews, because it doesn't come by often for sure. And so today on our panel, we do have 3 UT Dallas alumni. They're working professionals in the healthcare sector around the DFW area. And it's a little bit interesting because these individuals at one point were in your shoes. They were sitting in the same classrooms with similar classes and similar professors. And so from the point they graduated to now, what did they do to set themselves apart and build a career in healthcare? And so that's what we're going to kind of dive a little bit deeper into today. And so today's panel consists of Ms. Fallon Wallace, Mr. Keith Herl, and Dr. Salman Moti. And so we're actually going to start off by getting to know these individuals a little bit more, where they went to school, what drew them to healthcare, what company they're at, and a little bit about what they do on a daily basis for work. So like Quincy mentioned, we do have a chat box as well as some questions here from students. So we can go ahead and start off with Ms. Wallace, and then Mr. Harrell, and then Dr. Moti. Just talk a little bit about your history, where you went to school, your journey in healthcare, and kind of what you do a little right now.
Hello, everyone. As he stated, I'm Fallon Wallace. I received my undergrad from the University of California, Riverside. I majored in biology and chemistry. And then I received my MBA and Master's in Healthcare Management from UTD. I've always liked healthcare. It was something that I enjoyed even as a child. And when I saw that I decided that I no longer wanted to do clinical, and I saw that there was management, that gave me a chance to still be in healthcare. So that's how I was drawn to that. I work at Parkland Health and Hospital System. I am an operations manager for one of their primary care clinics. Since COVID, I'm also managing one of the Parkland run COVID testing sites as well. So in my role here at the clinic on a daily basis, it's managing all the operations of the clinic, including the budget, workflows, looking at staffing, also like facility issues and things that we need to do for the building itself, the structure, and also looking at process improvement to improve the workflows and the experiences of our patients. Keith?
Thank you, Fallon. So my name's Keith Herl. I'm currently the manager of talent acquisition at UT Southwestern. Just to kind of turn back the clock a little bit, I originally started in a different field. I have a master's degree in psychology. I was training to be a psychologist, kind of went off the beaten path, moved abroad, dabbled in education, and sort of fell into the healthcare world via physician recruiting. And in my experience, physician recruiting was a lot more of kind of a consulting type of role. And so I got to travel around the country and go to a lot of different clinics and hospitals and various places and meet a lot of great physicians and administrators and leaders and talk to hundreds of physicians, hundreds and hundreds of physicians, and just really began to see how vast the healthcare world was. And so I enrolled in the healthcare management program in 2013 and graduated with the dual degree with the MHA and MBA in 2015. So in the last 11 years, I've had roles in physician recruiting, a little bit of an entrepreneurial experience in the healthcare world, business development, sales, and marketing. I started at UT Southwestern back in January. So my team, I run a team of 10 employees. Our team does all of the non-clinical recruiting at UT Southwestern. So we have about 400 to 500 jobs at any given time that our team represents at some time. So thanks for the opportunity to be here again.
Definitely. Thank you so much. Dr. Moti?
Good afternoon, everyone. I'm Salman Moti. I'm with UT Southwestern Medical Center, just like Keith. I've been here for going on 9 years now. And healthcare for me was actually a second stop. My undergraduate degree is in economics. I started off in banking and finance and transitioned into healthcare as kind of my interests changed after my undergraduate experience. I did the master's in healthcare management at UTD, and that kind of taught me, because it's offered kind of through the business school, it kind of taught me to think about it as how you would run it if you ran it as a proper business. I think that was one of the big advantages of the program. And one of the questions that I had coming out of it was, how do you kind of scale this to the next level? And that drew me more into the public health space. And so I did a master's in public health through University of Illinois in Chicago. And coming out of that, kind of the underlying assumptions in public health is that at some point the funding will run out and you'll have to make do with what you have for as long as you can. I didn't find that to be a particularly satisfying answer, so I did the MBA at UTD to learn how you could, focus on budgets and making things budget neutral and seeing them continue into the long term. And as I was wrapping that up, I also saw kind of the premium that's placed on doctorate degrees, particularly healthcare. So I've also got a doctorate in healthcare administration with a focus on information systems from the Medical University of South Carolina. My team currently, I'm the Director of Health System Quality Operations Analytics. My team is about 40 folks with 3 managers and others that are analysts and coordinators. The group kind of focuses on the public reporting aspect of quality. It also focuses on management of our many registries that UT Southwestern participates in nationally. And it also does all of the analytics work in support of quality and performance improvement across the UT Southwestern health system. I'm excited to be on the panel today, and I look forward to your questions. Thank you, Mehul.
Thank you so much, everyone. And so a common question that we kind of saw when we were sending out this Google form is getting your foot in the door, especially during this COVID situation, especially for students looking for internships that are canceled or jobs that might be not looking for any individuals anymore. What kind of tips or advice would you give for someone who's a junior or senior in their undergrad for entry-level opportunities, or for younger people still in college trying to get their foot in the door in healthcare?
Just my anecdotal observations and experience, just even prior to COVID, a lot of internship opportunities, some of those opportunities that used to be there maybe aren't quite as available, or they're more competitive than they were at one time. And so it can be very competitive to get into some of those slots. Fallon was very successful at getting her foot in the door and doing a great job with that, and she could probably share her experience. But in my opinion, getting paid experience is important. So I'll just use UT Southwestern as an example. We can't count internships and unpaid experience toward experience for a job because we're a state institution. Those things can kind of play into the decision making, and they can certainly look good on a resume. But getting some paid experience, even if it's part-time, even if it's maybe not quite the level that you're looking for, getting paid experience early is important. Even if it's part-time, the years of experience still accumulate. So I know a lot of people take positions as scribes early on. Just that's a good example of one sort of entry-level position. So if you have that opportunity, definitely take it. And of course, you're making some money along the way. You're going to meet people along the way, and then you'll be building up references at the same time too. And if you don't have that opportunity, again, finding those internships and whatever they might be, just sort of saying yes to those types of things, and just getting experience wherever you can.
And I agree with Keith. It is more competitive now for the internships, but also with COVID here at Parkland, all the internships were canceled because we weren't allowing people into the building. So that really just kind of got rid of all of them. But when he was mentioning my experience, I did an internship at Parkland as well as an administrative residency. For me, it was networking. One of my classmates was and still is a VP here at Parkland. And I have been applying to Parkland, wasn't hearing anything. I reached out to him, and he put me in contact with their chief talent officer. Also, while we were in class, they had started a Young Professionals for Parkland group that he was advertising. I joined that and started working with that team, and reached out to the person I was working with there too, not knowing that she actually worked for my classmate. So by me making those connections, they needed another intern when we were preparing to open the hospital. And so they both happened to be talking and realized that they all knew me. And so that's how I got the opportunity for the internship. And also he was a big advocate for me once I applied for the residency. And so during the internship there, I was able to meet people even in my internship while we were working on opening the hospital, and they became references for me to help me get the residency program. So networking did definitely help me a lot.
Hey, Fallon, this is Dr. Barrett. You said something really interesting. You said, I reached out. What does that look like? If I'm a student and I don't have any experience, and there's this awesome woman named Fallon Wallace, how do I reach out? What does that look like? Help us walk through what that means.
In my particular case, because it was a classmate, I just walked up to him. But I do have, yes, I can tell you, I was not a big advocate for networking. I'm very much an introvert, so just going up and starting conversations with people was not a strong point of mine. And even when I started the degree program, a lot of times you would hear them say networking, and I was like, that's not for me. But in this, I really didn't. So I didn't try it. And most of the time, a lot of people worked, so we didn't really get there early before class to talk to people, or, when the class was over, we were ready to go home. But I took that opportunity just on a break during class one day and just went up to him and I mentioned, I've been, applying at Parkland. I don't ever hear anything back. Do you have any advice? And that's how that conversation started. I do have people that reach out to me via LinkedIn. And I've also had some people reach out through the UTD alumni email. So through that system, I've had people to reach out to me as well. And so if people reach out to me, I'll set up a time to speak with them and answer any questions, give them experience, my experience. And also if they want to come, I'm open to people coming and shadowing me to see what I do.
Perfect. Perfect.
Yes. And then
I think some people will ask the question, should I get an MS in healthcare management or should I get an MBA? And my only response to that is, well, the benefit of the MS in healthcare leadership and management is you get to associate with like-minded people. The MBAs might be going in manufacturing or finance, but an MS in leadership, healthcare leadership, you rub shoulders. And then the second observation is, be a good group project partner, because you never know who your boss will be. So if you're on a project together, don't be an idiot.
I definitely agree.
Be awesome.
Because that was another thing. When I was getting my internship, not only did the person I worked with on that group work for my classmate, but one of the interns they had was also one of my classmates. So all three of them, once my name came up, all three were like, oh, we know her. And so that classmate I had not even really interacted with, but she just observed me in class. So you're right, working on projects with people, you want to do your best so that they can see your capabilities, because even when I was on projects, when I would work with certain people, I could see that certain people were more of the leaders and some others were more kind of just laid back, didn't really talk, or they just kind of went along with the group. So when you do those projects, just know that people are observing you as well.
Hey, Fallon, this is Keith Thurgood. Good to see you again, and maybe
Hi.
answer this question as well. So we've been working on we've been talking about mentorship, and we'll reconnect on that at some point in the future. Do you have a point of view on the role of mentors? Has it helped you? Would it be valuable for our students, that kind of a thing? Or maybe Keith, you can jump in as well. Thank you.
I can start. So mentors have been very valuable for my career. Dr. Barrett was one of my mentors when I was there. And also I completed, Keith along with me, we competed in the ACHE case study competition. And so we were assigned a mentor, Ken Hutchenreiter at Methodist. And he continued, even after the program, he continued to be a mentor for me. And I was working in engineering at the time and changing over to healthcare. So he was one of the ones that suggested an administrative residency for me to get some healthcare experience on my resume. Also, I did participate in the ACHE mentorship program as well. And I was paired with Josh Florin from Texas Health in Plano. That was a good match for me because he had recently been employed at Parkland. And so he was able to help me make connections at Parkland, but also he helped me to see the different sides, like Parkland being a public institution and in Texas Health being private. But I have found that mentors have given me very good advice for my career. So I think it is a good thing to have a mentor.
Yeah, absolutely. That was spot on. The ACHE mentorship program really changed things for me. I had a mentor who she wasn't necessarily in healthcare delivery. She was kind of out on the periphery of a consulting firm, but she was heavily involved in ACHE. And so what she did for me was just a real kind person that I could ask questions to, but she set up probably a dozen meetings for me with her mentors and her colleagues. And so through that, I was able to get a lot of time with a lot of fantastic people. And that really gave me a lot of confidence that people cared about me and people cared about my career, and that, you know, people with great titles and great careers that could seem intimidating were willing to pay it forward and spend time with me. And, you know, I got to just see them as people that worked hard and saw their commonalities and their keys to success. And so I was able to really emulate those things, especially from a leadership perspective, you know, people that I could bounce career ideas off of. And when I was struggling, ask those questions. So for me, that was super formative. And well, you know, I'd say some of those relationships got me to UT Southwestern as well. So I've definitely had a couple of opportunities that I've gotten through networking and mentorships. Back to what we touched on before, as far as, you know, within you know, your program, but also out there mentoring, is to always treat it as a professional, in a professional capacity, as if you were at work or as if you were on a job interview. So always just minding your P's and Q's, not approaching those situations with an outcome in mind or needing something, but approaching those conversations and relationships just really from a perspective of wanting to try to learn and grow, and having a keen interest in them and where they came from, but not necessarily going in there with the outcome of, I'm going to use this to get a job or an internship or some other means, but just approaching it from open-minded perspective.
Yeah, definitely. I think that's a very important thing that you mentioned right there, because yesterday when we were talking to the CEO of Genesis Positions Group, he mentioned the same exact thing. Is this networking thing, we kind of use it as a way to get a job or an internship, and we're looking for people that will kind of put us in that place. But if you focus on the people, you focus on that relationship, then automatically they'll suggest you, and you'll move towards those different opportunities if you just build that relationship with that person. So definitely some really good advice. Dr. Moti?
Yeah, so during my time, I actually did 2 internships. I think the perspective that I would offer there is that don't wait until the end to try to identify these opportunities. If you're an undergrad student, it's not too early to start looking in your freshman, sophomore year. Don't wait until you're a junior or senior to try to identify these, just because it takes a few rounds for you to get comfortable with the process, and you don't want to do that while the clock is kind of ticking down, you know, you're running out of time. The next piece that I would kind of add in line with Keith and Fallon's remarks are the networking piece becomes important, but like anything else, it's an acquired skill. It's not something that you're going to just walk into and just charm everyone the first moment with the first conversation. It takes a little bit of practice, and it takes time, right? So the more that you're spending time doing these things, the better the chances that you're getting positive feedback. And again, as Keith mentioned, you should be, at least in my experience, you should be walking into networking opportunities as an opportunity to learn, not necessarily with a conclusion or an end game in mind where this person is going to lead to this next job. I can tell you that everybody that I have professionally networked with, from the first person that I stepped onto the UTD campus with and went to the first networking event, I stay in touch with to this day. And I've never asked that person for a job, but they offered me more than one. I've never asked them for internships, but they've offered me more than one. I think that kind of speaks to the strength of what networking has to offer, but you have to approach it in the right way. The last piece that I would offer is that you know, networking and internships, anything that you really are applying for and applying yourself toward, is a competitive activity, right? And so to be successful kind of there, you have to look at the variables that are in play. The first is how much time do you have, how qualified are you, and with whom are you competing, right? So my first internship, I purposefully didn't target as many internships in the DFW area. I targeted nationwide for internships, and I ended up in Mayo Clinic, where I could say comfortably there was 0 people from Dallas there, right? Nobody else from this area was targeting internships out of state, or at least that far away from here. The only reason I was able to do those things was because I was not on a clock trying to do my final semester. I was still early on in the program, and I knew that sure, it would be a little bit of an investment, even with it being paid, that I was probably going to lose money on it just because I have to move there and live there at on my own time. But it's really the investment opportunity, right? That you play the odds, but you know exactly what are the factors that you have to work with, and you set yourself up for success in that way.
Definitely, yep. And so you mentioned a little bit about your kind of experience at UTD, and all three of you were alumni in the master's program. So what is kind of one or a couple of things you wish you had known when you were in our position?
I think I can maybe start with that one. Something I wish I had known, I think I had it going through the program and even interviewing for positions thereafter, but the role that emotional intelligence plays in getting attention, the right type of attention, right? I interview several people throughout the course of the week, either for my own teams or supporting the teams of other leaders. And it's very clear when somebody comes across as, I'm deserving of this job and therefore you should give it to me. And there's other people that have, the highest qualifications and can remain humble throughout the entire process, right? And what we're really looking for, at least from my perspective on my teams, are people that can become future leaders. They're not just looked at to fill the role that they're in, but also future leadership roles as they become available. And so I think the emotional intelligence aspect kind of doesn't get as much attention, at least in professional development, as it should. But for those that have it and can operate with that at a high level, I think they have a distinct and a very strong advantage.
Absolutely, that's very well said, Salman. On top of that too, critical thinking is definitely another one too. Organizations have moved toward, we have interviews this afternoon, but moved more toward values-based interviewing and scenario-based interviewing, in which you do have to exhibit emotional intelligence and critical thinking skills, and experience does really feed into the quality of your answers as well. And so that's why, that's how the cream really rises to the top, so to say, having that opportunity to connect the dots and provide that critical thinking. Just being able to do that is a big attribute to stand out.
I agree with the critical thinking as well, because it plays a lot into my role now. We have many projects that we have here. And so with each project, you really have to think critically, because you have to think about not only the physical location of how and the physical structure of the building, but you also have to look at your staffing, your current workflows, your team. So it's a lot that goes into it. One thing I do wish that I would have done earlier was actually going out and getting that experience, like an internship before. I did it it was my last semester when I did my internship, but I do wish I would have done it earlier, where I could have had that kind of hands-on experience and actually seeing these things as I was going through the classes, because it probably, like, now that I'm doing it, it makes sense. I remember back, but I think it would have been even better experience had I been actually doing it as I was going through the classes.
That's a really important point. And specifically, you don't necessarily need to have anything paid, right? I mean, there's plenty of experiences that are unpaid, but they're experiences that build kind of a reservoir, so that when they ask you questions about, well, tell me about the time you worked with someone difficult, you can say, yeah, let me tell you about Bob. Yeah, let me tell you how I dealt with Bob. So experiences, I think that's a really good point.
And you're correct, because when I interview, that's one of the questions we ask. And a good percentage, I get people that have nothing to say. They're just silent. They're like, oh, I can't think of anybody. So like you said, having those experiences really does help when you're starting to interview.
Yeah, definitely. And so all of you mentioned that you interview students or interview potential job applicants within your field. And so, what is kind of some of the what are kind of some of the practical skills you try to look for within not just the resume, but when a person's speaking to you or when someone's interviewing with you? What are those practical skills you look for? I'm sure it's different for all the different positions you guys interview for, but what are some of those common ones that you think students could kind of develop or kind of work towards and get a head start on?
I know at least when we were part of the program, project management was definitely a big emphasis, and what I like to see are people that have more skills, more diverse skill set that can help out with other projects on the periphery. So people that have a more diverse skill set, people that can manage projects and kind of bring into what we were talking about before, but have some tangible experience managing projects that they could relate back to us in that process. So that way we can see some demonstrable results and things that they've done before. And then, initiative is something that definitely is important. I think less and less do we have time to train people and to bring them on slowly. I know at UT Southwestern, we often need people to hit the ground running one way or the other. And so we're looking for someone that maybe can demonstrate that they can come in, have the intelligence to learn, have the motivation to learn and seek out information and ask the right questions and really figure things out for themselves as much as possible. So it's people that could take initiative and move forward without a lot of extra direction and hand-holding.
You mentioned project management. Is it important that these students have that kind of experience within the healthcare field, or is it okay if they have project management experience within like maybe the organization that they're volunteering at or an outside kind of community that they've managed a project in? Is it key that they focus on healthcare, or what would you suggest?
Well, I think the closer you can get to that job role and the functions, the better. But I don't know if it necessarily matters 100% as long as it's clear what the objective was and what the results were. Salman, I know you've hired some project managers recently, right?
Yeah, so I think to Mehul's question, a lot of those skills, the experiences are directly transferable, although the mechanics of something like CMS rules or HCPCS codes are very specific to healthcare. And if you were to find that would be an Easter egg kind of a situation. But I think being able to play nice in the sandbox, being able to build those relationships for the long term, and then being able to translate the requirements of whatever project it is through to a deliverable, I think translate well. So I think if, as Keith mentioned, if you're able to demonstrate that through the way you answer questions, being able to reference these other projects, that's more than enough to get attention.
Ms. Wallace?
When I'm interviewing, I'm looking at communication. So when I'm looking at the resume, I'm looking at how it flows, what information you are providing. There's some where it's very general. I was a cashier and I collected payments. And I see somebody else who says, I was the top cash collector. I collected, $2,500 a week. So I look at the details. The more details you can provide to me is better for me. And also during interviewing, I'm looking at how you respond to the questions. So if I ask a question and I just get yes, no, that's it, I will be more favorable to somebody who can actually give me an example and actually explain. So I look at that communication as well. And I do take into account that I know some people are nervous, but we have to be able to communicate. I also look at, when I'm looking at the resume, I'm looking at any other thing that they're putting on there, such as organizations, volunteer work, any type of certificates or different things, because usually when I see people involved in other activities or, looking at different certificates, those are usually ones that kind of show me some leadership, like they're have a goal they're trying to advance. Also, when I am interviewing, I'm also listening to the questions that the candidates ask me. So I had one candidate that came in and she had a notebook, but she had already done her research on Parkland. So I knew she had done, by the things she was mentioning about Parkland, I knew she had done her research, but she also had questions. So she had questions about, what are the expectations for her? She had questions about, the stability of the clinic, morale, so she was asking more detailed questions. And so to me, that was showing me somebody that was really looking to make sure that they were a fit for the organization as well.
Absolutely, asking good questions is a must. And yeah, if you conclude an interview without asking a single question, you could just pretty much kiss that goodbye, unless you're really great from a technical standpoint. But just to kind of take it a step further from what Fallon and what Salman said, it's all about the framing, right? And whatever your answers are, whatever your experience is, pull it back into the job description or the question or in context of the hiring manager. You need to show how your experience or the answers to your questions will add value to the hiring manager. So continue to bring that back in and then tie it in with the practical a practical notes. And as far as this role, I could see myself taking what I learned there and applying it in this way. So you're continuing to sell yourself and continuing to apply it and frame it in the context of how it would benefit the department or the hiring manager.
And in addition, I would say it is very important to prepare for your interview in advance, because I have had people, when we get on and start the interview, they'll ask me, where is this located? Or they'll ask me, what are the job responsibilities? Well, if you haven't looked that up, to me, that's not a good sign that you are interviewing for something and you don't even know what you're interviewing for. So make sure you are reading the job description and know what it actually entails. Also, one of the questions that I ask people is, what are their career goals for the next 3 years? And a lot of times I get silence. So to me, do you even know what it is that you really want? Where are you going with this? Or I will get someone that'll tell me, and I know they haven't looked at the job description, because I'll have somebody tell me they want to be a phlebotomist. That has nothing to do with the position that I offer. So it was like, that lets me know you're just trying to get your foot in the door. So you wouldn't be a high candidate for me, because I know that you probably aren't going to be there long. So you want to make sure that when you're interviewing, that you know what you're interviewing for, and make sure that when you're describing your skills, it's related to that particular job. And be able to answer that question as to what your goals are. Even for me, I would rather you tell me, I'm still trying to decide between 2 or 3, rather than you to say, have no answer at all.
I'll kind of chime in on that point as well. I think, Fallon, something you mentioned resonated with me. I think for people that interview other people very frequently, it's very easy to spot somebody that is very targeted on the position that you're offering versus somebody that is just trying to get away from the position they're in now, right? That's very easy to spot throughout an interview process. And so if you're not clear on why you're sitting across from the person you're sitting across from at that table, you can't clearly articulate that. That is something that you can practice. UTD has a lot of resources on mock interviews. There's one that's going to be coming up soon here, I think in a couple of days. And so I think if you're walking into an interview without having practice, you're probably not going to come out of that with the outcome you're looking for.
Yeah, well said. And another thing that Fallon said to kind of articulate on here, if they're asking about your goals in 3 or 5 years, just a little bit of ambition is okay, but they're going to want to keep you for more than 3 years. So if you're talking about the next role or the next step, you might get passed over because they want you to help them as long as they possibly can. So your answer almost always is going to be, we're going to meet these departmental goals in 3 years. We're going to meet departmental objectives. I'm going to focus on mastery of my role for the next 3 years, and then we'll see what happens. It's something to that degree, but just don't get too ambitious. Don't look too far ahead.
Definitely, yeah. And so in terms of, I guess, in the virtual setting, is there things that you guys recommend that are a little bit different for interviews, or any tips that you guys might have for like an interview like this in terms of rather than in person? What kind of like, I guess it's pretty similar, but is there anything that you guys have seen with your experience that's a little bit different or unique that you guys might recommend to students to prepare for?
Sure. So I think from my side, being mindful of kind of the constraints that you have on time, right? So make sure you're available right on time, and that if it sounds like the conversation is running over, you pause and you call that out to the person you're interviewing with. Hey, we might go a little bit over. Is that okay? Or do you have a next meeting, kind of a thing? So kind of being respectful of their time. The next piece is keeping yourself organized. There's a lot of material that people may want to cover, and in 30 minutes, it's probably not possible to cover your life experiences. So the more you can share through like an online portfolio or a packet of work that you can send to them ahead of time that they can review, it keeps those conversations that much more focused instead of just going off in different directions. You can't really control to what extent the person interviewing you is going to be prepared, but it's in your complete control how prepared you are to that situation. And so kind of the goal that you're going into it with, I think, is not just putting your best foot forward, but also realizing that you're interviewing the company to see if they're going to be a good fit for you. Sure, they may have a position open, but if what it is that you aspire to do doesn't align with what you're hearing in that interview, that's something that you need to be prepared to take note of and be able to process, instead of just finding yourself flat-footed and just accepting that this is available, so I'm going to take it.
Just Keith, do you have anything to add to that?
Yeah, I mean, the technical component of it just adds a lot of variables. So make sure that you're as prepared as possible. Get in the chat room before. Make sure your set and your setting is clean. Approach it the same way as you would a face-to-face interview. Whether that's just your hygiene and the way you dress. Kind of take those same steps to get yourself in the same frame of mind for it. And then make sure that your environment, like I said, is clean, and that your connection's working fine. Just all those variables, try to remove any of those as much as possible to make sure that you're going to have as good of experience as possible digitally. Quality of your sound, quality of your video, quality of your own audio, making sure that there's not an echo in the background when you have your microphone on, all those types of things. If you can mitigate those, then you can save yourself a little bit of a headache on the back end.
Definitely. Yeah. And so all of you kind of mentioned that you guys are at healthcare companies, but you're doing operations, you're doing talent acquisition. You could be doing that in different industries. So what chose you to kind of stay in healthcare after all these years? Ms. Wallace?
I actually enjoy healthcare. For me, I get a benefit from seeing the patient. So I walk around a lot, so I interact with patients. And there's one that sticks out to me. It was a gentleman in his diabetes class. He had been taking the diabetes class, and he was so excited that he got his A1C down. And so he wanted to show me his lunch he brought with his fruit and his vegetables. And it was just seeing how, that's something to us. It's like, oh yeah, you got it down. We're excited, but it really meant something to him, and he wanted to share. Also, when I get calls from patients on just how well the staff has treated them or how they have helped them change their life. I had a young lady that came and interviewed, want to work here because she said she had a seizure episode here in the clinic, and just how the people treated her, she wanted to work here. And so we have a lot of stories of patients that, have transportation issues. Financially, they're not stable. They're having to choose between medication and paying for their rent. And so when I know that I can give a benefit for them, that's what makes me keep staying.
Definitely. Mr. Keith or Dr. Moti?
I think there are definitely two sides to the coin. There is the practical side too, and that such a large of the workforce works in healthcare, and it's definitely not going away anytime soon. We have an aging population in need of more and more healthcare. There are definitely a lot more innovations that are happening and hopefully will be happening at an extended pace going forward. So it's a very stable industry on the whole, and it's not going away. We'll probably move toward more automations and use of various technologies, but the human component will always be there. But as Alan touched on, I think all of us have stories of being able to really help people and touch their lives. And I think if you look around it all the way, we all are supporting the delivery of healthcare, and I think we can feel that sincerely. And that does feel good. That does feel good that we are doing our part to help keep people healthy and help people stay healthy.
Yeah, I think what Fallon and Keith have shared is right on point. For myself, the reason that I've kind of stayed in healthcare as long as I have, again, this wasn't my first stop; it was my next stop. Is that the challenge in healthcare kind of remains, right? That although I've been in healthcare or at THR, at UTD, or UT Southwestern, that there's always something that's challenging that you can find to work on. And healthcare, I think, for a lot of people, and it should be for practically everyone, healthcare is personal, right? It's the delivery of care from one person to the next person to help them. And you can do that from a lot of different perspectives. There's, there's the IT component for people that wish to be technical. There's the finance component that are better with numbers. There's the operations component that are better with management. You've got quality and Lean Six Sigma and performance improvement. Anything you can think of, you can find with a healthcare lean to it. And I think as long as you continue to be challenged, at least for myself, as long as I continue to be challenged in healthcare, I expect to remain. And I think for people that stay with it long enough, I think they end up having some type of personal experience that gets them that much more invested in staying in the organization, and if not that, at least within the industry. I mean, my own daughter was born in the hospital behind me. And so you can kind of see, the harder you work, the better the outcomes there are. And it's not just a abstract idea. It's real people that you can put faces and names to.
Yeah, definitely. I think that's one of the main things a lot of students kind of find, or that draw them to healthcare, because in other industries, you're working with other people, but you don't get to see that direct benefit that you're providing to those patients. And that's in any industry in healthcare, right? So that's a really big point for a lot of the students at UT Dallas as well. And so as we kind of near the end of this panel, what are kind of some take-home messages or some practical steps? I'm pretty sure a lot of students here that attend this panel are motivated to apply now and network out. And so what are kind of some take-home messages that you would give to students as we conclude this panel?
Well, I think this is a good chance to maybe extrapolate a little bit on what Dr. Moti said about sort of the variety of roles within healthcare. And as I mentioned at the top of this, my team recruits for all the non-clinical positions. So, and we also have a university here on campus too, so we sort of have that academic and research component. But my team recruits people from groundskeepers and facilities managers and plumbers and locksmiths and police officers, you name it. They're all sort of work on the periphery of healthcare. But as a leader, as an operations person, keep in mind some of these niche areas that maybe aren't as sexy or as immediately apparent as what we might think. We tend to think of, hospital administration and operations really as sort of the best pathway. But there are so many other areas when you think about facilities management, think about environmental services, auxiliary and guest services. There are a number of niche areas that tend to be a little bit less competitive, where you can go and get your foot in the door, establish yourself within that organization, produce results, network, and then work your way up into a different area, perhaps of preference. So at UT, a third of our positions are hired internally. So we've got a lot of movement, a lot of promotion opportunity. So just sort of getting your foot in the door and finding that niche. I didn't think I would get back into talent acquisition and that this would be my route, but it is. And I'm comfortable here, and this is a good spot. So just kind of keep an open mind and be strategic about where you might go and where the competition is a little bit lesser.
I agree with Keith. Sometimes you may have to take a role that is not straight into management. For instance, here at Parkland, once COVID hit, there was a lot of openings for guest services, people taking temperatures at the door. While those may not be, leadership roles, they are still a way to get in, because even though you're at the door and you may only be taking temperatures, people will see you when they're passing you. I will look at a person and see, are they smiling at me? Are they greeting me saying good morning? Are they able to be helpful to me? And so no matter what role you have to take, don't let it show that that's not where you want to be, because we can tell that too. If it's a role somebody doesn't like, we can tell by the attitude that, hey, that's not what they want to be. So you really, whatever role you're taking, take advantage of it and learn all that you can, because that's even a way to meet people networking. Just by saying good morning, it can lead to another conversation, and you never know how that can bring up another opportunity for you. Also, when you are looking at getting in, don't try to go in too fast. I get that people, and they want to go straight to management as soon as they come in. It's always not that easy to just come in, because a lot of times they're looking for some type of experience instead of somebody coming straight out of school and just trying to get into the management role. Also, depending on the organization, sometimes you have some that for their, like the role that I'm in for managing the clinic, sometimes they will want somebody with nursing. So you also have to look at that. You may have to look at a management at a different, it may not be for the clinic, it may be something within the clinic, maybe the business function or something else. So it may not be the same title. So you want to look at, don't limit yourself to certain titles. You really want to look across the board at different opportunities. And then once you get there, just networking, volunteering yourself for things. That's what I did in my residency. I would be in the huddles and I would hear them mention a meeting, and I would just go up to the person after and ask them, do you mind if I attend this meeting? And that's how I got to learn more and to meet people. And they got to a point where they started asking me, hey, Fallon, you coming to this meeting? And they would tell me about meetings. But also, don't always look at the pay either. For me, I came from engineering. So when I went to the administrative residency, I took a large pay cut. But for me, the money that I was losing didn't compare to the experience and what I could do in the future. So it's always not, everybody wants to make the most they can, but don't make that be a deciding factor for your opportunities.
Yeah, I think what Keith and Fallon have shared are right on point. I think I'd connect my remarks to maybe a couple of the questions that are coming through on the chat. So Becky's kind of asking about, we've touched on things about forming connections before we entered the job, but what about after kind of entering that job? And Quincy is asking about what are some things that students can go in and kind of implement now? And I think a good start to an answer for both of those is to get creative. If you're leveraging the opportunities everybody else is leveraging, you're just in a sea trying to get noticed. You have to figure out ways to get noticed in an environment that's very competitive, and being creative about that is a great way to go. A good example of that I can share is, when I first started at UT Southwestern, the executive over our group was kind of on her way out. She was joining Baylor, and as she transitioned into that role, I sent her an email as the first email she received at Baylor, right? And she'd never shared this email address, but I mean, if you look around any organization, email addresses are probably the easiest thing to guess, right? And so when she returned to UT Southwestern as a higher level executive, those relationships kind of continue, right? They don't just fall by the wayside just because your email address changed. So I think being creative in how you pursue some of those things. The other thing is to, as you step into these opportunities, either through internships or residencies or fellowships or permanent roles, leverage the power of the domain that you've got. So like at UT Southwestern or at UT Dallas type email addresses, because basically every person in that organization will recognize that the end of your email address, and they're more likely to respond to you. So when I was doing my internship at Mayo, I made sure to get in touch with people that were doing the job that I aspired to do upon graduation. And I said, hey, I'm here as an intern. Is it okay? Can I stop by and maybe shadow you guys for a couple of days, maybe on the weekend, whatever's convenient for you? And I've never had anybody say no, because you're not really asking for anything more than just following them around and just trying to learn. So I think if you position yourself, in that way, you're more likely to get the outcome you're looking for.
And if I could add one thing, something anyone can work on at any time is communication. And if you're a poor communicator, you may not be able to express, just how good you are or what your ideas are. So especially writing. So writing, business writing, speaking, public speaking, always take those opportunities and be a good writer. I would say being a good writer has probably been and I probably overestimate myself, but being a good writer is probably helped me in my career just as much as anything that I could possibly think of. And, whether it's just business communications, email etiquette, all those things are extremely important, and they do accumulate.
And if I could add one more thing, I think I want to piggyback on Keith's comment about communication. I think especially while we're in this digital environment, working remotely for long periods of time, that it becomes that much more important that you can clearly articulate your message, but also do it in a respectful way that's succinct, and kind of tailoring your message to the audience, right? So the way that I would communicate what it is that I need from an analyst would be completely different than the chief quality officer, for instance, right? I would expect an analyst, when they read my message, to reply back with a few paragraphs kind of explaining the situation and what they're trying to get done, whereas the reply I would expect from a C-suite executive is yes, no, to like an entire email string, right? That's the type of the window of opportunity that you have. So you want to make sure that you maximize that.
Definitely, some very good insight as to how to kind of be in that professional field. So I really appreciate all three of the panelists coming out and spending time and taking time out of your busy schedules. If no one has any questions, I think this is a good spot to end our panel event for today. Thank you all, Keith, Salman, Fallon, for all attending and taking time out of your busy schedule. I'm sure a lot of the students, especially myself, got a lot of good experiences and a lot of good insight as to how to move forward on the next step. So thank you.
Thank you for the opportunity.
Thank you all.
Quincy, do you have anything last remarks?
No, I just really thank you so much. Wow. I mean, this is incredible. And I think that this information, as Dr. Barrett put it, is gold. Students hearing that you all have been there, for them to really kind of take some of these things to heart and to maybe make their own to-do list. You gave really great actionable items. So I think we really just appreciate your time. And we recorded this, so we'll be posting this on our web pages. So hopefully students will get a chance to pay it forward and let other students hear it as well. But we really appreciate all of your help with this. Thank you so much.
Thank you.